Hello, I'm Dr. Chris Davis, offering my learnings as a physician and politician. Dr. Bruce Shepherd AM, a magnificent advocate for patients on many fronts, including as founder of the Australian Doctors Federation, exhorted us to remain the patient's doctor, not the politician's servant, nor that of big business. It is a battle we are currently losing, with devastating consequences for patients and our profession. AHPRA is central to that deleterious transformation, having usurped our profession and replaced it with a political quango that denies us our independence, identity, and self-regulation, so permitting every bribe or dictate to undermine good clinical practice to the detriment of patients and our nation. AHPRA is a massive autocratic machine bureaucracy suited to coercive subjugation of our profession, but totally unsuited to skilled and agile regulation of modern complex medical practice. It is appointed by bureaucrats and so is beholden to them. Its inevitable harms and costs are borne by practitioners, patients, and society. AHPRA harms with impunity and immunity. To illustrate this, some years back I was appointed the clinical director of a major discipline in a leading academic hospital. Without reason, AHPRA declared it was not satisfied with my perfectly valid continuing professional development return. This caused the job offer to be withdrawn. The Ombudsman advised that it was open to AHPRA to act in this manner. By law, it was not open to them at all. By law, AHPRA is required to be transparent, accountable, and fair. They simply ignored this, being the sort of conduct that drives some of our colleagues to commit suicide. They disregarded their paramount obligation to ensure the health and safety of the public by ensuring the most meritorious candidate filled this key hospital appointment. But exercising their absolute power that corrupts absolutely, their paramount motive instead was presumed retribution against me for my earlier opposition to draconian doctor contracts. Such corruption, mendacity, and untrustworthiness go hand in hand, dragging our society down. Doctors are now forced to take instructions from those who are not trustworthy, and in the process have themselves become contaminated. Doctors historically earned high trust ratings, but are now pulled down to 66%, being obliged to practice contrary to their training and judgement. This undermining of the therapeutic relationship has negative implications for health and well-being. We can see this in data from the Australian Institute of Health and Welfare. In 2024, Australians lost a staggering 5.8 million years of healthy life, either due to dying prematurely or through suboptimal management of illness or injury. We know that access to quality general practice with excellent continuity of care is vital for reducing this massive burden of disease. And yet it is in AHPRA's watch that we've seen a massive decline in fragmentation of quality general practice, demonstrating that AHPRA's claim to improving quality and safety for patients is unfounded and harmful. Here we see the burden of disease over time and observe that prior to AHPRA, the total burden was declining significantly. More recently, under AHPRA, the decline has not progressed, and in fact the burden is increasing. This comes at considerable cost for individuals and society, as well as frustrating GPs through being unable to practice effectively and efficiently. The cost of AHPRA is not only in terms of life years lost, but the increased cost of running an ideological edifice. Here we see that the actual inflation-adjusted cost of medical registration has jumped by 58% comparing pre-AHPRA and post-AHPRA periods. These are costs that result in badly needed doctors retiring early. They also need to be passed on to patients, so exacerbating the cost of living crisis. Taking highly skilled, ethically obligated professionals like doctors and then tying them up in expensive red tape is one of the reasons Australia's productivity is flatlining. This contributes to Australia lagging well behind comparable countries in per capita disposable income, whilst heading for record national debt. Countries such as the UK are recognising that quangos such as AHPRA impair productivity and economic outcomes, and so are disbanding them. Australia needs to do likewise with its ideological quangos such as AHPRA. The choice facing our medical profession now is to whether to appease a costly deception that is being perpetrated on Australians in the form of AHPRA, or to act decisively to ensure that profession-led expertise and services are once again available for the benefit of our fellow citizens. This is not a new challenge, as Dr. Yunussi, now chair of the Australian Doctors Federation, identified some years ago. But as services collapse around us, the time for talking is over, and the need to confront reality is critical. As Dr. Yunussi says, I think it's time for our politicians to abandon AHPRA and go back to the drawing board, and they should let doctors do the drawing. Thucydides, the general from ancient Greece, observed that the strong do what they can, the weak suffer what they must. Doctors, by their vocation and training, are not adversarial, but it is now necessary for us to fight for what our patients and our profession requires of us. We are honour bound to be courageous. In summary, subjugation of the medical profession under AHPRA is failing patients and society. AHPRA has not and cannot improve health and safety. Like all failed trials, it is time to abandon AHPRA and revert to what was working well until thrown under an ideological bus. Doctors owe it to patients to become strong and unite to do what they can, or else suffer alongside their fellow Australians. We must urgently overcome fear and turn retreat into advance. Thank you.